Hi, my name is Dr. Mark Halpern, and welcome back to my series of short videos on chiropractic care. Today we're going to be discussing pregnancy and adjusting pregnant women. During pregnancy, the body is growing and adapting. There is a hormone called relaxin which is released by the body, and what it allows the body to do is grow. The ligaments and the joints will get floppy or loose, causing irritation to the joints. The goal when adjusting pregnant women is to keep the baby healthy, to allow the pelvis to grow, and to reduce symptoms on the mother. It's also possible with the proper care to encourage the baby to come out in the proper position as opposed to upside down or sideways. The technique we use is called Webster's technique and is very gentle. When people come in my office to get it adjusted, we use a pillow called a pregnancy pillow. And in the pregnancy pillow, there is a hole here, as you can see, for the stomach, which is also just relieving for women to lie on because they probably haven't been able to do it in a little while. What I'd like to do is go through a typical adjustment and show you exactly what this is all about. So I'm going to get my expectant mother on the table. Great. And then we position her just so that she is comfortable. And then just like any other patient, we want to make sure that there is balance in the spine. And the first thing we will look at is leg lengths. Now you're going to notice with this patient, the left leg is short. Please turn your head to the right. When she turns her head to the right, the leg is still short. Please turn your head to the left. When she turns her head left, the leg's now even, indicating that there is some type of pressure on the right side of the neck. So keep your head there. And using the drop pieces makes the adjustment much easier on the patient. Okay, look straight down. So what we're going to do is grab our contact, lift the headpiece, and remove the pressure from the nerve. Now, if you follow me down here, we're going to come back and check the legs. Now, the left leg is still short, so look back to the left, and you'll see that it now stays short, meaning that there's nothing left in the neck to adjust. Look straight now. There's also indication that the sacrum, instead of sitting straight, which is the tailbone, is tilting like this. And when it tilts that way, we want to contact the opposite side of the sacrum and straighten it out to take pressure off the pelvic area. And I'll show you the way we do that if you just back up a little bit. So we contact the base of the sacrum, and again using drop pieces, come back. Now, if we take a look, we're not perfect yet, much better, but we still have some irritation in the lumbar spine. And now we have perfectly even heels. The last thing to do would be to go through the rest of the spine, the thoracic spine and the lumbar spine, to make sure that there is no additional pressure. But now that the nervous system is balanced, the legs are balanced, we've taken the pressure off the pelvis. Just like any other patient after the adjustment, we will also check the ankles, knees, hips, and wrists, just to make sure there is no additional irritation in the spine or in the extremities. If you'd like any more information about this or anything else, you can always find me at www.thetorontochiropractor.com. Have a great day.